mindfulness is something which I think has really caught the popular imagination over certainly the last year or two and has gained momentum in the NHS as well as elsewhere. But I thought the other day that it would be very useful for us to consider this, because not only is this a fairly stressful time when it might be helpful as a practical discipline, but also it's worth us being able to talk to our patients about it. It's worth us knowing about what evidence there is behind mindfulness. So, Nicola, it's great to have you in the studio. Nicola Smith, you are a counsellor and you're a mindfulness expert. How do you feel about what I've just said? Is there a lot of evidence behind mindfulness?
There really is, yes, huge amount of evidence. If you Google mindfulness studies, then you will be overwhelmed by the number of studies. And I think the earlier studies were basically around people with chronic pain and those people who had relapsing depression. And they're the ones where there's the strongest evidence for mindfulness.
And is this coming out, is there an ongoing study in the NHS or elsewhere looking at what is happening with mindfulness now?
Yes, there are. There are a lot of different studies around. I mean, I can obviously send you some information if people want to look into specific ones. But
well, it would be nice perhaps to have some research if there's been some credible research out there, because I suspect that a lot of people are still wondering whether it's a bit of a fashion rather than evidence-based medicine, which is, of course, what we're all taught we must adhere to these days.
Yes.
What are you going to do with us today? You're going to give us some practical demonstrations of mindfulness.
I am, yes. I'm looking forward to that. I do think I can talk about mindfulness, and I will do a little bit of that and answer questions as well. But I do think the way to understand mindfulness is actually to try it out. So I thought we would do at least two practices today if we have time. So,
excellent.
That'd be great.
Well, before you start talking to us about mindfulness, I just wanted to say to everybody that I have done my homework and I have been out and I have bought some Lindt chocolate and some Green and Black's chocolate.
Perfect.
Just to see if either has a more beneficial effect than the other. I promise to try and finish them by the end of the show.
Right.
Why do we need these?
Sorry, say that again.
Why do we need the chocolate?
We need the chocolate because we're going to do a meditation on chocolate. So, using chocolate as part of the meditation, just to show the different ways that we can meditate. So I think sometimes people think and assume that meditation is all about sitting cross-legged in some exotic, quiet place. But actually, mindfulness is something we need to be able to do every day. It's much more helpful, I think, if we can bring it into our everyday lives.
So tell us what mindfulness actually is, then.
Okay, so there are lots of different definitions, as you can imagine, but one of the ones I like is that living in mindfulness is a way of staying regularly and calmly in the present moment. So one of the things we're trying to do really is to bring ourselves into the present moment on a more regular basis than we normally would. Most of the time, many of us spend a lot of time lost in our thoughts somewhere else. We're not actually sort of in the activity in the room that we're in. We're very much kind of thinking about what we've got to do next. And I know that was certainly my experience before I did mindfulness. I was doing something, but I was always thinking about the little list of, to-do things that I needed to do later. And mindfulness has helped me to kind of keep focused.
Just in terms of how we use it in medicine, as it were, I suppose that's the only reason to use it is because it is a psychological protocol, isn't it? That's the right word. Is this something that someone who has not done some formal course in mindfulness would be able to advise patients on, or do they need someone like yourself who is trained in psychotherapy and in counselling and other disciplines to take them through the process?
No, I think yes, yes to both in a way. I mean, obviously, it's ideal if you've done it yourself. I think that's certainly the way to kind of best deliver mindfulness and mindfulness advice. However, there are lots of really good apps and programs out there that are available that you can direct your patients to. So again, I mean, I can give you some recommended
that would be
information.
helpful. Yeah.
Because I think if you go online again, I mean, you would just be overwhelmed, and some of them are better than others. So I would definitely do that.
So in terms of what practitioners, primarily osteopaths, chiropractors, physiotherapists, will get from today's session, they will be able to direct patients to a useful resource. Yes. And they'll be able to explain how it is that mindfulness can be useful to them.
Yes, yeah. But I think also, hopefully, the other huge benefit I'm hoping is that they will get a taste of what mindfulness is like for themselves. Because I think as a sort of self-care, philosophy, if you like, it's really, really helpful, I think, for those of us that work in health. And, when we're dealing with lots of other people's problems, we need to...
I interrupted you, so I'll let you carry on with your chat about mindfulness now.
Yeah, no, that's fine. That's fine. Yeah, so I mean, I think it is really important that we do care for ourselves first, and then we are in a much better position to care and listen to our patients. We're going to be there for them much more easily if we're in the moment listening to them, rather than actually thinking about what we're going to have for supper later, or do I need to pop into Sainsbury's on the way home, or whatever it is. And then being able to bring yourself back to focusing on what you really need to focus on, or what you really want to focus on in the moment.
Okay.
Okay.
So are you going to give us a demonstration or talk us through the experience?
I think that would be really nice to do that now, actually, as a kind of settling in thing for everyone. So I'm going to do something called the 5 things exercise, which is really quite a nice way of using our senses really to help us be mindful. So can I invite us all to consider the way we're sitting, our posture? That usually makes people kind of sit upright, but we do want to encourage that a bit. But I think the important thing is that we're comfortable. And then invite people to place their feet flat on the floor, just so that you can feel your feet on the floor, hands on the lap, and then maybe just pushing oneself just to the back of the chair a little bit more, so that, I mean, it does depend on the chair you're in, but just so that your back is a little bit more upright. So just hands resting comfortably on the lap, and then just closing the eyes for a moment, just to be aware, or dropping your gaze if that's more comfortable, and just start by just being aware of the contact points of the body at the moment. So you might want to just be aware of your feet on the floor, just noticing the feel of your feet on the floor, just being aware of the main contact points, perhaps around the ball of the foot and the heel, maybe a sense of your feet inside your socks, your shoes, your slippers, whatever you're wearing at the moment. You may even want to give your toes a little wriggle just to check that they're there, and just having a sense of that sensory awareness, that sensory connection with the body. And then moving the attention from the feet up to the seat. So really we're talking here, I guess, about the buttocks, the backs of the legs, the lower back, and just being aware of those contact points. So just tuning into those, just noticing any sensations that are there. Perhaps there's a sense of coolness, warmth on the hands, on top of your lap. Maybe there's a sense of contact with the buttocks and the lower back, perhaps feeling supported by the seat. And just noticing those for a moment. Just letting yourself settle into the posture that feels right for you at the moment. So the main thing is doing what's right for you right now in this moment. And then if we take the attention from the contact points of the body now to the eyes. So as we go into the next moment, if I can invite you to open your eyes, and you may want to look at the screen, perhaps first of all. I'm assuming that most of you are gazing into a screen. So you might want to notice the screen, just notice the frame around the screen, notice what you can see on the screen at the moment, noticing the people that are there, the backgrounds, perhaps colours. And then just giving yourself a moment or two just to notice any 5 things, either on the screen or around the screen. Just 5 things that come into your awareness of sight, your vision at the moment. Don't need to go searching for them. I think you'll find quite easy to notice 5 things you can see. And then I'm assuming that won't take too long. Then if I can just ask you to gently close your eyes or drop your gaze again, just to help you focus. Because the next thing I'm going to invite you to do is to focus your attention on your sense of hearing. So maybe just being aware of any 5 things that you can hear at the moment. And again, you don't need to go searching for them, you don't need to list them. We're really just noticing, just observing any 5 things in this moment. Just allow 5 things to come into the awareness of your ears. Some of them may be distant sounds, some of them may be very nearby, some of them may be loud, some may be quiet. And then for the third part of this exercise, just moving your attention now from sound and hearing to feeling. So just noticing any 5 things that you can feel at the moment. So it could be things that you feel internally, or it might be things you feel externally as you sit here. And just being aware and tuning into any 5 things that you can feel. It doesn't matter if you don't get 5. Again, you don't have to list them, remember them. It's just observing them in the here and now. Just letting them come into your awareness. And then gently bringing the attention away from the sense of feeling, and bringing the attention back to the body as a whole, just sitting here. That's just having an awareness of yourself sitting here on your chair, noticing how that feels, noticing things about your body, about your posture. Has anything changed? Does it feel more comfortable now? Are there things you want to change? Just really tuning in to whatever's here in this moment. I'm just going to ring some bells just to denote the end of the exercise. So as we come to the end, just gently open your eyes again. Okay, so I forgot to ring the bells at the beginning, but we normally ring the bells at the beginning and the end because it helps people to know when we're doing the actual practice and when we're going to.
And tell me, are you doing these normally online now, or do you have to do this in person with your clients?
Online at the moment. So I've got some ongoing sort of drop-in sessions that I'm doing in my other workplace. But I'm also offering mindfulness courses online as well.
Right.
Yes, that's from the new
And
year.
would you be doing that with multiple people attending, or is it one-on-one?
No, I'll be doing it with multiple people attending. So one of the best researched and best ways to learn mindfulness is learning it in a group. And we were discovering that we can do that perfectly well online as well. So so it's a group of people going through the experience together, learning together, is really, really helpful.
Right, so we did, I don't know how many minutes, 5 minutes, 6 minutes, or something like that, of just working through our senses there, sitting down, feeling everything that was going on, listening, and so on. What has that achieved?
Okay, so one of the things I think that people may have noticed is that using the senses gives you a way of bringing yourself to the moment, of kind of anchoring yourself in the moment, which is what we're aiming to do with mindfulness. But hopefully what they also may have noticed is they may have noticed that their mind has been wandering, and we'll talk a bit more about that in a moment. But our minds, are perpetual wanderers. Sometimes people talk about it, it's a bit like the puppy mind, and we have to keep noticing where it's gone and pulling it back. And we don't give ourselves a hard time about that. We just accept that's what our minds do. But we can train ourselves through something like mindfulness to bring ourselves back. So if we have something like the senses or the body or the breath or chocolate today, to help anchor our attention in the moment, it can make it a lot easier, especially in the early stages where we're less practiced at it, really.
And what does the evidence say about how this is affecting things like chronic pain? I mean, you said that people with chronic pain are benefiting, but what is the proposed mechanism of action for that?
Okay, I mean, there's lots of theories about it, but I think one of the main things is really that what people find is when they have chronic pain, it actually draws all their attention to that particular part of the body. And what mindfulness does, I think, it allows the perspective to be a little bit wider. So I think when we're focused on pain, especially if it's quite strong, it grabs our attention. That's what it's meant to do. But obviously it's not helpful if it's chronic pain. It's something we have to learn to live with. So mindfulness helps people to perhaps have a slightly more accepting stance towards the pain, but also to have the choice about whether they focus on that pain or whether they perhaps focus on other parts of the body where there isn't so much pain. So it kind of acts as a way of anchoring the attention to other things.
And do you deal with lots of chronic pain patients yourself?
I have had some, but it isn't the main things I've dealt with. I guess one of the main ones that I'm dealing with really are people with other issues around their well-being, so perhaps more psychological issues like anxiety, people who've had depression, worry, and other sort of psychological problems, I guess. But also I think people do see mindfulness as something that actually improves their well-being in general. People who find that life is very stressful, mindfulness is a way of helping you to be more resilient.
Yes, and I guess I'm thinking in terms of, I'm sure you're familiar with the term central sensitization, which is the term used where the feedback to the brain is such that it can't shut out what would normally be insignificant pain signals, and so everything is magnified. And I just wonder whether mindfulness is effectively, in some ways at least, is working to address that. But I also wonder whether mindfulness appeals to a certain type of person. And I have a certain type of person in mind at the moment who suffers chronic pain. And I'm pretty confident that if I told this particular patient to sit down and think about his buttocks and the backs of his legs and the 5 things he could hear, I'd get some negative feedback. I'd get some negative kickback even. I just don't think that he would particularly feel that this was a remedy for pain. He's convinced that it's drugs or surgery or treatment that he needs and not psychological. What do you think about that?
Yeah, I think that is one of the issues that people really struggle with, and I think understandably, really. I think, and I think we are very primed to see, that we need to fix our problems, and certainly that's the case with pain. And so we go back and forth, get lots of medical interventions to try and help with that. But I guess mindfulness perhaps most helpful when those have been explored and there aren't other avenues to go down, and that mindfulness can help people to perhaps live with their pain differently. And some of the people that do a lot of mindfulness teaching are people that have experienced chronic pain themselves and are living daily with chronic pain. So they speak from experience, and just how radical and helpful it is. But it is, as you say, quite hard, I think, to convey that in the first place to people.
How is it being used in the NHS? How do they encourage the buy-in that's needed from chronic pain patients?
Well, I guess it's a case of giving people a chance to perhaps have a taster session, a little bit like we are today, and talk to their therapist, whoever they're working with, about what could be achieved. And I think it's also kind of getting across the idea that it's not the only answer. It's not the only thing. It's not going to be a complete cure. It's not about that, but it's about sort of living with the pain differently, really. And and that could apply for psychological problems as well. We're learning to live with anxiety, stress, depression differently when that comes and goes.
You said that a lot of your patients are not pain patients. They're actually they've come to you for other reasons, for anxiety or whatever. Is there a category of patient that has been identified as being most susceptible to benefit from mindfulness?
No, I don't think so. I think it's just that most of the research started with those with relapsing depression. Mindfulness isn't that helpful when somebody's in the middle of an episode of depression, but it's helpful to help prevent future relapses, and that's where the strongest evidence is. But obviously similar things can apply, obviously, to anxiety, worry, and stress, problems with stress and so on. So,
which I suppose getting slightly off the main topic of mindfulness, but maybe a lot of practitioners will be thinking, well, if someone hasn't already had a diagnosis of depression or stress, anxiety, whatever, what should we be looking for? Are there significant clues that we should be looking for to say, actually, you might benefit from going to see Nicola and learning about mindfulness, or whatever else that you might want to advise?
Yeah, that's a really good question. I think it's really looking for, I personally, and I would say this, wouldn't I? But I think most people can benefit from mindfulness, but I think obviously not everybody's open to the idea. So we have to sort of try and discern that a little bit as well. And obviously before they start a course of mindfulness, I would meet with people individually and talk to them together about whether this is the right thing at the right time for them. But I think if you can have a sense that that somebody is intensifying their problems, perhaps by the stress that they're putting on themselves, by seemingly very worried about the future, or perhaps very caught up in past stuff, then mindfulness could be a really helpful thing, I think. Yeah.
Susan's just sent in a question asking about whether you are ever concerned about using mindfulness in PTSD cases.
Yes. I mean, one of the therapies I do actually works directly with people who suffer from PTSD. So I'm very well aware of sort of the problems with trauma, PTSD and so on. The way I found it helpful is if people have some treatment, perhaps something more proactive directly with the trauma first, and then mindfulness is really helpful after that to do a course of mindfulness. That's worked out really well with quite a few people I'm aware of. So yeah, definitely helpful.
I might be missing something in that question, because that obviously sparked some interest in your mind there. Why would you be worried about using PTSD? Simply because it might not be the best therapy, or because it might provoke something adverse?
Because it could, if somebody is in full flow of the symptoms of PTSD, it might be a bit triggering for them. It might be too soon in a way. They will be able to benefit from some aspects of mindfulness, but perhaps doing a whole course may not be the right thing. And I think it would have to be explored with the individual first to see, identify what they would need.
Right. I've just realised I did you a bit of a disservice at the start here, because I glossed over what you do for a living. You are a counsellor, you're a psychotherapist. You mentioned
Yes.
You mentioned something else there, which I know what it is, but perhaps you'd like to tell us.
Yeah, of course. Yeah, so I'm a CBT therapist, so Cognitive Behavioural Therapy, but I'm also trained in something called EMDR, eye movement desensitization and reprocessing, which is a heck of a mouthful, hence it gets reduced to EMDR, which is a trauma-focused therapy. So so that's another really important part of my work. And I find mindfulness is helpful in conjunction with that. There's quite a lot about what we do in both CBT and EMDR that kind of really matches very well with mindfulness. But I would stress again that you don't have to have these problems to get the benefit from mindfulness. I think many of us health practitioners, especially, and teachers is another category of people that I feel experience a lot of stress and really benefit from mindfulness.
There's probably a whole 90-minute broadcast that we could do on EMDR, but can you give us the 30-second, the elevator pitch on what EMDR, how it works, what do you do with it?
Okay, so EMDR helps people to deal with the troubling memories that are unhelpful when you've experienced a trauma. And so for some of those people, the trauma may have been many, many years ago. But what EMDR does is it helps people to let that trauma rest in the past instead of it being something that's actively distressing, triggering on a day-to-day basis. And it does that via eye movements or other bilateral stimulation. So there can be lots of different ways. There's tappers, there's headphones, all sorts of different ways of achieving it. Is that okay for a quick elevator pitch?
I think so.
Yeah.
And,
there's lots to explore, as you say.
Lots of people will probably have heard of EMDR, and I've heard of it because we've got two people in my own clinic who do that, including yourself.
Yeah.
But actually, I confess I don't actually know how it works or what it does, but we will come back to
it. Come and do another broadcast about that, maybe. Yeah.
I've got a great question from Carolyn Norgate here. She says, can you suggest, and I like it because of the last sentence, she says, can you suggest different ways of introducing patients to mindfulness in terms of using alternative vocabulary or framing it differently? Because many people have preconceived ideas and they immediately think it's too woo for them.
Yes, no, I agree. Difficult to come up with a word that expresses it, because as you say, it does have a lot of connotations with it nowadays, especially that it's a bit sort of new agey perhaps. But I think, perhaps an everyday awareness. I think I would avoid meditation, because again, I think that's another one that perhaps even more so than mindfulness. But explaining, and I mean, the kind of mindfulness I teach is something called Mindfulness-Based Cognitive Therapy. So it is, a therapeutic technique as well, and introduces elements of CBT within that.
So perhaps, I mean, for those people who like to look at research on these things, and many of the osteos, chiros, physios watching will like that.
Sure.
I'm sure there is terminology in there which explains this is the mechanism of action. It is by directing your thoughts in a particular way. So instead of saying mindfulness, which does sound like a fashionable term these days, or meditation, which it's not. Perhaps we can just say that we can use your mind, the power of your mind.
Yeah.
To
I mean, another way I think that I find helpful as well to people is just telling them it's a training program for the mind, a bit like a fitness program for the mind, because, you know, we go to the gym to get physically fit, and mindfulness is a way of helping us to get mentally fit, and we need to practice regularly to keep that fitness. We don't go to the gym and sort of just stop when we're fit. We continue to keep fit. So mindfulness is a mental fitness program, if that's perhaps a more helpful way of understanding it.
And this is all very helpful, of course, because you won't be aware of this, I'm sure, but certainly chiropractors and physiotherapists, chiropractors and osteopaths are required to communicate with patients in ways which the patients can understand.
Yes.
And putting it into terms like that is helpful in clarifying in the minds of the patients. So, and of course, everybody watching is thinking, he's saying that so he can justify ticking that one of the practice standards off on the certificate afterwards, which is true, because, but that's actually what we're doing.
Yeah, of course.
Right, I'm getting quite...
ready for the chocolate?
I want to know something about this chocolate.
Yeah, no, absolutely. Nicola. Well, what we're going to do is I'm going to invite you all to have a go at meditating with chocolate. All it means is you need to, first of all...
you said meditating.
I did, yes. Yeah, I did. Sorry about that. Okay, getting mentally fit with chocolate. How about that?
Yeah.
Okay, so can I ask you first of all to get 2 pieces of chocolate, quite small, or 2 raisins, or 2 pieces of cheese, or whatever it is you've chosen. I'm going to just, I have a bar of chocolate here.
I think my definition of small might be different to everybody else's definition.
Yeah, possibly. I think of it as what you can get in the mouth at one time. So that may be something.
That's 2 bars.
This is, Okay, we'll see. So it's a challenge here from Stephen, I think. But so I'm going to ring the little bells, and I'm going to invite us to take part in this exercise. So let's call it that. So, okay. Okay, so I'm just assuming everybody's had time to get their props ready. And can I just invite you, first of all, to settle into a comfortable position again, as we did before. So just making sure you're comfortable, making sure that your feet are perhaps flat on the floor, that your seat is comfortable, sitting a little bit more upright than maybe you normally would. And then this time, have one hand perhaps on top of the other. And onto the top hand, just place your 2 objects, your 2 pieces of food. And what I'm going to ask you to do is just to try and imagine, if you can, that you're coming at this with beginner's mind. So what we're aiming to try and do is imagine that you've not seen these objects before. We're just trying to, I guess, anticipate that we might have certain reactions to these items normally. So we're going to be just taking our time just to notice them resting on our hand, first of all. So we'll just give yourself a moment or two, a little bit like we did with the first exercise, just using our sense of vision, really, first of all, just to notice perhaps the difference in shape and size between the 2 things we have on our hand, being aware of colour, maybe being aware of the way the light interacts on the surfaces. And then maybe just gently kind of moving them around and perhaps picking one of them up, giving it a bit of a squeeze, putting it back down again, just turning them around on your hand. And you may start to notice the feel on your hand. You might start to notice the sticky traces that are perhaps left behind as you move the objects around. So just giving yourself a chance to get the feel of them first of all. A sense of perhaps this beginner's mind allowing you not to prejudge what the experience is going to be like. Then we're going to invite you just to choose one of the objects. So leaving one behind on your hand and the other one just picking it up and perhaps having a sense of why you chose that one. Perhaps there was something that made you choose that in particular. And then maybe just moving to smell. So bringing the object up to your nose and just noticing what, if anything, you can smell at the moment, what comes into your sensory awareness of smell, what's there for you at the moment. And does that sort of bring up any kind of anticipation of actually getting to consume this in due course? And just noticing any reactions. Are there are other thoughts that come up? We talked about how the mind wanders. We might find that as we smell, various memories, thoughts come up which take our minds away. And then we're going to use our sense of hearing, which is perhaps a little bit unusual with something like something we eat, but just tapping on the item and just seeing if there's any resonance there. There might be a sound, there may be nothing at all. And then just, once you've done that, just in your own time, just placing it back on your hand again. And now getting ready to choose the one that you're going to consume first. So again, making a choice, perhaps noticing what's brought you to that particular choice, picking the item up in your hand, and then just gently just taking it up to, just sense it on your lips first of all. So you might want to just pat it on the lips, just see if there's any sense of anticipation that comes with that. Maybe noticing the smell as well as the touch on the lips as you do that. And then when you feel ready, I'm not going to join in with this bit, so I won't be able to speak, but just place the item on your tongue, but without moving your mouth at all. So just leaving it there to rest on your tongue for a moment. And just seeing how that feels. Just noticing perhaps whether there are urges that come up for you that want you to move the object around. And you may find you focus more easily on this exercise if you just close your eyes or drop your gaze for a moment and just to really sense the experience. So just holding it there for a few more seconds, if that's possible. Just letting the perhaps texture change a little bit. You may notice changes as you keep the item there. And then gently starting to move the object around the tongue. So perhaps just noticing that there are different taste buds there, which may bring up different flavours as you move the object around. And then maybe just pushing it more towards your teeth perhaps now. So without really chewing, but just letting it move around your mouth, just seeing how that feels. And noticing what sort of things are coming up. And then maybe as you anticipate the idea of chewing, just starting to think, are you noticing that there's a particular part of the mouth that you naturally move things to do the chewing? Just see how it feels, perhaps to notice that, and maybe do the opposite, perhaps move the object somewhere else in your mouth to do that chewing. So taking on the action of chewing now, just seeing what's left to chew. Maybe there isn't that much to chew now. Maybe the saliva has already done its work in breaking things down. Just seeing what flavours are there as you chew, what senses, what textures. And then maybe starting to anticipate swallowing the object. So when you feel ready, just allowing the object to slide down if it hasn't already, and just seeing how that experience is just noticing the feeling as the object goes down into the throat. And then just being aware of, are there any traces left in your mouth as you sit here? And then once that one has gone, then if I can invite you to just consume the next one in whatever way you like. So perhaps doing it in exactly the way that you normally would. And just see how that feels, see what you notice. So just placing it in your mouth, doing whatever you normally would do when you eat something like this, and just noticing the difference. And yeah, this is the stage where Stephen is demonstrating that we may need to grab a tissue or a hanky to to wipe the hand. Often some sticky traces left behind. So I'll just give you a moment or two to finish the eating. I'll ring the bells because we will be able to talk again. I think once Stephen has finished consuming.
Well,
Or,
thoroughly enjoying my green and blacks. I
Excellent.
might do the same thing several times more later in the day. Obviously, my
Please do.
choice of chocolate was dependent entirely on which was the largest piece to start
all right,
with.
yes, that's
But
often interesting.
I'm very conscious now that you said you've got to smell this, and of course I poked myself in the nose with a piece of chocolate, so I've probably got a blob of chocolate on my nose. And then you said tap it, and I thought you meant tap it on your ear, so I've probably got chocolate all over
right.
my ear, and it's probably all over my teeth. But it's a thoroughly enjoyable experience.
Excellent.
So I thoroughly recommend mindfulness with green and blacks chocolate.
Yeah.
I'm also conscious that now this is very Pavlovian, isn't it?
Right.
You ring the bells and we think of chocolate, so everybody starts to salivate, which is exactly what happened with Pavlov's dogs.
Yeah, I hadn't thought of it like that, but yeah.
We've had some questions.
Yeah.
Vlad has said, if it's appropriate, as osteopaths or chiropractors, I guess, is there some sort of accelerated course to being able to help our patients from a CBT mindfulness counselling perspective? Is there something that people with our level of medical training perhaps could do, which is a shortened version of the in-depth training you've had? Nicola?
Right, yeah. I mean, I have done shorter courses, and quite a lot of practitioners do, particularly with, say, teachers who maybe feel they need a shorter course as well. So we've done the course in 6 weeks rather than the 8.
Which course? The mindfulness?
Yes, the mindfulness course, sorry, yeah. But I'm not aware of any specifically for practitioners that are any shorter than that, really. I would say on the whole, if you get much shorter than that, then you miss out quite a lot.
But that's not 6 weeks of solid training every day of the week, is it?
Oh, no. Basically what it would involve, the mindfulness course, I mean, if you did the 8-week course, it would be approximately just under 2-hour session per week. And then obviously the invitation to sort of do the practicing on a daily basis as well, because obviously that's what develops the skills. Because essentially what we're doing, it's a training program, so we're developing skills. And the more you can do that as an individual, I think it's easier then to develop those as delivering that to other people and recommending it to others.
What about CBT? And Vlad also mentioned counselling in there as well. And clearly, counselling particularly is it's a pretty in-depth skill.
It is.
With all sorts of constraints around practitioners and monitoring of practitioners as well.
Yes.
Is there any? I don't want to use the term shortcut, but is there any way of developing a level of ability there that you can help patients with?
Yes, I mean, I guess there are things you can do. You can look up online, but I think it wouldn't train you to be a counsellor or a CBT practitioner. But I mean, I think you can perhaps get some of the principles, which may be enough, to support the work that you're doing. But I think if somebody does need counselling or CBT or whatever, then obviously they need to be referred to someone that can do that. But I think there are some principles that
How long is a standard CBT course?
Well, the one I did was a year, but again, it was a once a week attendance thing. Well, it was over a year actually, because it was a postgrad course. There are different ones available. The CBT, best place to look it up is the BABCP, which is the British Association of Behavioural and Cognitive Psychotherapies. Again, we may be able to provide a link to that.
Yeah.
That tells you a lot about CBT training, so that may be a good place to start.
And what were the entrance requirements for that course? Do you remember?
Well, because there are lots of different courses, it's difficult to say. Difficult to say. But I mean, with the one I did, obviously, I was already a mental health practitioner. So I think, as I say, there would be different ways that people would work, which would obviously mean that the entrance requirements would be very different according to what course people are wanting to do, really, and how they want to use it. I mean, it's a bit like the other way around. I guess you wouldn't really want to be recommending an osteopathy course, too much of a crash course for someone like me to use. So I think it's trying to sort of balance it out, isn't it? So we can have some skills we can share.
Well, I think it's a fairly optimistic inquiry, I think, because of, for example, the osteopathy course is an awful lot shorter for someone who's done a medical course.
Exactly, and it's the same sort of
and vice versa, in fact.
Yeah,
but
absolutely.
there's not so much crossover between psychotherapy, mental health issues, and osteopathy training, or chiropractic training, I guess.
Yeah, but certainly the mindfulness course will be a quicker way of getting some of those CBT principles, I think, and techniques that you could use with your practitioners as well, definitely, yeah.
A couple of people have apparently asked if the OsteoMap training is still running, which was a course being run at the UCO, the University College of Osteopathy, Mindfulness and Acceptance-Based Training. Apparently that study has now finished, so I don't know any more about that. If anyone's got any more information, please share it with us. But Lucy has sent in an observation, Nicola. She says that she's had both CBT and EMDR, and mindfulness crosses over with both of those, which I guess you knew anyway. But she's also used the body focusing techniques to help reinforce proprioception. Is that something you're familiar with?
Okay, no, I'm not actually. So no, so I don't. But that does
well, maybe
sound
Lucy,
interesting.
maybe Lucy can send in a bit more on that.
Yeah, I mean, I think obviously mindfulness does focus on the body quite a bit. So I mean, I can see how that would be helpful. Definitely. Yeah.
Yeah.
Okay.
Interesting. I mean, years and years ago, I remember doing. I did some sort of. It wasn't directed by anybody else. I just decided I would have a look at auto-hypnosis.
Okay.
In order to focus my mind on doing some things that I wanted to do better. And a lot of that seems to cross over with meditation and mindfulness in terms of that, start at your toes and see if you can feel all of this. And then in this context, in hypnosis, I think it's quite common to say, right, well, now tighten all those muscles and now tighten the other ones and feel that sensation through the body.
Yeah.
But all of those disciplines do seem to overlap quite a bit, don't they? And they all seem to add emphasis to the idea, the fact that we can train the mind to help us deal with a lot of other problems if we do it right.
Yes, absolutely. Yeah, and I think, I mean, one of the things I think that is really important, I think, when we do mindfulness and we learn mindfulness skills is we start to kind of bring the mind and the body together much more. A lot of us get, as I said, we get very lost on what we call autopilot, sort of lost in our thoughts, doing things in a very autopilot way. I mean, I'm sure we've all can think of lots of experiences that we go through in life where driving, for instance, a lot of people have that experience. I've certainly had it where you've driven somewhere and you realise you cannot remember anything about the journey, and sometimes you end up at the wrong place because you've done an autopilot journey that you regularly do and forget to take the turn you needed to take. So we do spend a lot of time on autopilot. So I think what mindfulness does, it helps to bring the mind and the body together a bit more, and we notice how much of our body is affected by what's going on in the mind. And I think that mind-body reactivity is a really important clue to helping our well-being and helping us to look after ourselves better.
Just quickly before we finish, Nicola, if a patient goes to see their GP with, it could be any sort of problem, but typically for osteopaths and chiropractors, our patients will be suffering some sort of pain, I guess.
Yeah.
But if a patient goes to GP with pain, whether it's chronic or acute or whatever, what is the standard response? I mean, are GPs now schooled to think mindfulness, find a mindfulness practitioner, or do they have to go to some specialist service for that?
I think generally they would probably go to a specialist service, but they might suggest. I mean, it does depend on the GP, I think, doesn't it? But they may suggest that they will know that mindfulness is helpful for people with pain, and certainly a lot of people get referred to specialist pain centres, and they offer mindfulness very much as a central part of what they do.
So does mindfulness feature in the NICE guidelines anywhere?
Yes, it does. Yes, both for pain and also for depression. And increasingly, there's lots of more research where it's going to be introduced for all sorts of other areas as well. I mean, there's a lot of research going on in schools. Houses of Parliament have regular mindfulness courses, and so there's a lot in terms of making mindfulness accessible to lots of different groups of people, not just those with medical problems.
Have you got some more you wanted to cover?
Well, I was going
We're
to
very
go
much up against the clock, so yes, please.
I've got a little quote I thought I would just read, which I thought might be helpful as well, in terms of selling mindfulness to the patients as well, and perhaps as a response to the pandemic too. Mindfulness is not the answer to all life's problems. However, life's problems can be seen more clearly through the lens of a clear mind. Okay.
Yes, very, very nice. I like that.
So yes.
Very quickly, Carolyn has said, would some life coaching courses also incorporate mindfulness?
They would actually, yes. I've been to something at the British Psychological Society a couple of times where it's been a life coach that's actually doing some training with incorporating life coaching and mindfulness. Yes, there's quite a lot of stuff on that.
Nicola, that's been brilliant. Thank you very much.
You're welcome.
Actually, that time flashed past. I haven't had time to finish both my bars of chocolate. I haven't even got close to it, but I should put some work in later.
Absolutely, please do. Yeah, and I'll catch up later too. I've got mine here. Yeah.
Thank you again.
Okay, thank you.